everybody. Today, another special day for the Mindful Heaven organization. So today we are going to start our Voices of Recovery, Living with Addiction, second podcasting. So I am very honored to stay with Mindful Heaven podcasting sessions. And today we have a special guest. So her name is Mariam Halait. She is a clinical psychologist and she has been going through this drug rehabilitations process for many years. So she has been working Shifa Caring Center in Islamabad. Plus, not only that, Mariam, she is a substance abuse counselor and she has expertise not only the substance abuse, but also she is working with other mental disorders, other mental health, and she has a very good expertise about anxiety, trauma, and depression and other psychotic disorders as well. So she is not only the therapist, but she is always a good educator. So that's the very unique feature which is coming from Mariam. Mariam is a good lecturer. He has been teaching and he has been conducting the webinars, webcastings, and even the workshops, even in Mindful Heaven organization. Apart from that, some other organizations. So I am very delighted to stay and sit with Maria and discuss about these voices of recovery and living with addiction, the second episode. So I don't want to waste Mariam's time. So what I can do, I will warmly welcome Miss Mariam Harit. Hi, Miss Mariam. Good evening.
Hi, good evening. How are you? So, am I audible?
Hi, Miss Mariam. How are you?
Hi, I'm good. What about you?
Yeah, I am good. So we were facing a little bit, connection issues. So that's fine. Right. So, Mariam, so can you give a brief about you, if you can?
Yeah, sure. First of all, you have given such a great introduction of myself. So I would also tell about myself something. So I am a clinical psychologist and a substance abuse counselor right now at Mindful Heaven organization.
Yeah.
I have
Mhm.
experience of working with a wide range of individuals facing mental health challenges, from children with neurodevelopmental disorders to adults facing different mental health challenges like anxiety, depression, trauma, and even addiction issues. So,
Yeah,
yeah,
that's great. Yeah.
I also conduct webinars and
Mhm.
workshops. Now I have joined another organization that is basically Leading Stars, and I am conducting webinars over there as well.
Yeah. Yeah, Mariam. Mariam, your mic is mute. Mariam, I think your mic is mute.
Was I audible when I introduced myself?
Yeah. That's fine. Yeah.
Oh,
All right. All right, Miss Mariam. So, right. So, okay. So, I think you remember, I think the last first episode. So, I have discussed with addiction with Miss Sunila. So she is also clinical psychologist, right? So where we have stopped from Sunila, I would like to start from you, Miss Mariam. Is that okay to you, Mariam?
yeah, sure. Go ahead.
Yeah. All right. So Mariam, so so for the first episode, if I summarize within 1 minute, so we have discussed about what do you mean by the drugs, what do you mean by the addiction, and what kind of a most addictive drugs are available in around the world and even in the Pakistan. Plus, we have discussed about uh, how people are addicted very easily, because we know that some people are addiction, their addiction is coming very easily because of the genes and genetics issues as well. So that's the summarization of first episode in the living with addiction, right? Sorry, from the second episode. So there are some important questions. I think you are the best person to answer these questions, Miss Maria. All right, I will start the first question. So we know, like earlier, we have discussed about the what kind of substances are available in the market. So what are the most addictive substance? So whatever the substance, whatever the drugs, so there are the ways of taking the drugs. Like say we say that like the route of administration. So the people or individual or the person, how they are taking drugs to their body, the way of taking drugs to their body. So I think Mariam, since you have many years of experience in rehab centers and you have been working with substance use disorder individuals, I think you may have discussed in a wide range of people who takes many variety of drugs. So by that kind of expertise and experience, can you tell me, so what are the most available or most prominent or most dominant way of taking the drugs to the body?
Yeah, sure. Sure. If we talk about that, how a person is taking a drug, it has multiple routes of administration. Like if we start counting, there are multiple. But some of
Yeah,
the most commonly used ways are like snorting, like the person inhales through their nasal passages.
yeah,
And in the powder, drug is basically crushed to their powder forms like methamphetamine or cocaine,
yes,
etc. and
Mm-hmm.
those are inhaled through their nasal passages, then that get absorbed into the mucous membrane, and then goes into the bloodstream and then to the brain, and then it has that effect. And
Yeah,
then
that means
uh,
inhaling means from where? Inhaling from nose or where?
yes, yes, from their nose, their nasal pathways.
All right. Mm-hmm.
Yes. Then we have injection. Injecting is another and the most commonly
Yeah.
used, a route of
Yes, yes.
administration. Now, the where the injection goes, it has different. Either it is administered into the veins, into the muscles, or under the skin. It depends.
Yes, the
So,
injecting, I think, Miss Mariam, it's a very dangerous thing, I think, for the other co-occurring disorders. Sometimes for the other physical disorders, like, it can spread AIDS, and is that so?
yes,
Yeah?
yes, that's a very dangerous way when people don't
Mm-hmm.
follow the basic, hygienic
Yeah.
requirements are not fulfilled when they are sharing their syringes, and
Yeah.
if someone is
Sharing.
infectious or that, it can cause HIV or hepatitis and other infectious diseases.
Yes, that's a good
So
point. Yes. So we
yeah,
have
yeah,
to the individual, even, let's say that one of the individual who still have taking this injection method. So if they listen this podcasting, please remember, do not share. Do not. We have to say that, no. Do not share your needle with anybody else. Right? It's a safety method.
yeah,
It's like you are doing some unsafe. If you feel that it's unsafe, safe, so you please, like say we say that, okay, better to use the condom, like that. So that kind of a thing. Remember, don't share the needles, even you injecting the drugs to your body. It's very, very dangerous. You will be end up with dying very easily, and you will be having many, many issues. Yeah. Is that so,
yes,
Mario?
yes, yes. You have said very right thing. Like it should be, people should be aware of these things, that they should practice these hygienic practices in their daily life.
Yes, yes,
Also, we were talking about the routes of administration.
yes.
There is another
Uh-huh.
way, that is smoking. Like it's
Yeah,
also
smoking.
very common, in which the
Common one.
person is basically inhaling the smoke of the drug. The most commonly, if we talk about the Pakistan, the
Yeah.
tobacco cigarettes are the most common. Like
Oh,
people think that if they are smoking something, then it is not that much dangerous. They are saying that we are not taking any
yeah.
pills or we are not taking any drugs, but they are not realizing that actually this smoke is affecting their lungs, that can be dangerous and can cause lung cancer and very serious issues.
Yeah, you well said. Yes, Miss Mariam, you are very well said that, because most of the people think that the smoking is a very simple thing. They don't think the dangerous of that. Am I right?
Yes, yes, you are very right. Also, there is another aspect about the smoking, that is we call passive smoking. That the
Uh-huh.
other people around you that are not even taking directly the tobacco, but they are inhaling the smoke that a person is smoking, like passive smoking.
Yeah,
It
yeah,
is
yeah.
also damaging their lungs as well. So it's not only dangerous
Oh.
for the person itself, but also for the people around them. It's very damaging.
Yes, Mariam, Miss Mariam, you have mentioned very, very valid point. See, if I am a father, let's say I am a smoking. See, I have a kids and my wife is there. Let's say, so because of my smoking, so they have infected. They will got the tobaccos to their bodies. That is called second hand smoking. So most
Yes.
of the countries, second hand smoking, even from the second hand smoking also, that it leads to the cancers. Am I right, Miss Mariam?
Yes, yes, you are right. Also, if according to my experience in the rehabilitation center, when we take
Mm-hmm.
the history from the clients, and we came to know that almost every client who is addicted to any kind of drug, he has started from the smoking. The first
Yeah,
drug that he has taken is smoking tobacco. Like at start, they
correct.
think that it's nothing much, like but it becomes so much dangerous later in life.
Yes, I will add at one point, Miss Mariam, for your very good point. So this also, the smoking is most of the gateway drugs. Let's say, what are the gateway drugs? It's a smoking nowadays. Gateway drugs would be the even the cigarette, most of the time tobacco products and even the cannabis, which means so the individual in a very first time in their life experience, they do smoking as you said. Yes, very good point.
Yes.
And any other way of taking drugs, Miss Maria?
Yes, yes. Another way is taking drugs in oral method, like swallowing through your mouth. It could be in the
Uh-huh.
form of pills, it could be in the form of liquid syrups as well, like prescription medications, etc. Mostly are taken through this route of administration. It is a
Yeah.
little bit of slow process, but it has long lasting effect.
Yeah, yes. So that's a good point as well. So which means if I summarize your points, so it's like we have a snorting, we have a injecting, we have a smoking, and we have a oral taking. It's a swallowing, and another one. So it's a by there are some drugs that they are entering from some other body parts as well. Some, right? So that as well, and even there are some drugs we are pasting our skin as well, like LSD, stamp, right? So they just paste on our skin from the, but it takes onset time is different. I think Miss Mariam, you will agree with me. What would be the most onset drug, which means what is the the smoking is the most onset way of taking route of administration within the 7 second it will affect to the our CNS, central nervous system. Am I right?
Yes, yes. Also, the injecting way is also very instant because it injects drug
Yes.
directly into our bloodstream.
Yes, injection is, but when you compare with the smoking and the injection, most of the people have a wrong idea. Most of the people, Miss Mariam, as my knowledge, they think that injecting is faster than the smoking. No, smoking has a 7 seconds, right? The time of 7 seconds, but injecting is only it affect before after 10 seconds. So there are 3 seconds, right? 3 seconds ahead is the smoking one. So
Yeah, yeah,
remember,
I
so
agree.
yes, smoking is the uh, most affected way of drugs to the central nervous system. Yes, I think so. That question is very. I think we have answers, Miss Mariam. Actually, I'm very happy you have highlighted very from your experience the good points as well. All right, Mariam, Miss Mariam, we will go to our next question. So I'm asking. I want to ask from you, since you are a good person to answer for this question as well. What is the drug tolerance and what risk or dangers does it pose? Which means I am asking about the drug tolerance. What do you mean by the drug tolerance? And what kind of a risk or the dangers does it pose?
Drug tolerance is basically a condition in which the person is not getting the same effect from a dosage of drug which he or she was taking previously. Like
Yes,
previously,
correct.
he was taking a specific amount of a certain drug, but now when he is taking that drug, he is not getting that relief. If he is taking a painkiller, he is not getting that relief, or he is not getting that same effect.
Mm-hmm.
It's basically considered as tolerance. Like
Yes.
the body
Yeah.
and our brain adapts to this.
Yes, I just want to add one thing, Miss Mariam. So you are saying that so the tolerance is it's like even you take the same dosage over the time, so you will not get the same euphoria, the same relaxation, same high, right? Due to within the the earlier dosage. So because of that, if you want to make the same same high or same euphoria, you need to have more dosage. Is that so?
Yes, yes. Increased amount of that drug is not required to get that effect.
Yes, right. Okay,
Now
and
there
Miss
are
Maria, yeah, can you explain about the what risk or dangers does it pose?
Yes. Tolerance can have various dangers. Like first of all, it can have some overdoses side effects of any medication or any drug, like nausea and vomiting. These are some physiological symptoms that someone can get. It can
Yeah.
also cause a person to become dependent on that drug, like to have that their body starts requiring that drug. Whenever he is increasing that drug to achieve the same effect, it can lead toward dependence, and then it can further goes towards the addiction thing, that is a compulsive use of drugs to avoid
Yes,
the
yes.
withdrawal symptoms.
The dependent,
Yes,
yeah, yeah. Sorry to interrupt you, Miss Mariam. The dependency, which means because of the tolerance, that it leads to the dependency. So that means, for if I say simply, the dependency means he is 100% craving for that drugs. 24/7, he is focusing on how the taking the next dosage of the specific drugs or the substance he is addicted. So that is kind of a dependency, which even as you said, Miss Mariam, the tolerance will leads to the dependency. Yes.
yes. I also want to add one point, that
Yeah. Please.
most of the time people don't get the reason why their body is getting tolerated to certain drugs. There are multiple
Mhm.
reasons. Either their body or their brain becomes adapted to that specific amount, that now they are not responding to it. Like it
Correct.
could have various reasons, that sometimes the receptors are not receiving the reacting to that amount, or sometimes the
Yes.
organs
Correct.
become adapted or become efficient and breaking down that drug so efficiently that it removes the drug from their bloodstream faster than before, that they are not getting the required effect.
Right, very good point. That is about the you are talking about the reward system, the
Yeah,
dopamine reward system. Yes. So the dopamine will not release with the same dosage because the tolerance. So he needs to take more dosage. Then only the dopamine will release. So that's leads to the tolerance. Yeah, that's a good point in a scientific way. Miss Mariam has explained in well. Thank you, Miss Mariam. I think those two questions what I have was it was we you were given nice explanations. Everything is clear. All right. Moving forward. So I request you to ask my third question for Miss Mariam. Mariam, can you tell me about does developing this tolerance, right? If can we say someone is addicted?
that's a much needed question to ask, because people got confused about this thing, that when
Yes.
they are developing tolerance to a certain drug, whether they are becoming addicted to that drug or not. So the
Mhm.
answer is no.
No.
It not it does not always mean that when you are
Not
getting
necessarily.
tolerated to a
Yes.
yes, yes. If you are getting tolerated to a drug, does not mean that you are getting addicted. It depends on the drug as well, and also for what purpose you are using that drug
The
and how you are
persons,
using that.
yes, which means that it's depend on the even the individual body chemistry as well, right?
Yes, yes. For example, we were
Yeah.
talking about the tolerance. Like tolerance means that we are requiring more amount of that drug. While if we talk about the addiction is basically a compulsive behavior. I will discuss the example of a painkiller, because for
Yeah.
a layman to understand it easily. Because if we talk about the addictive drugs, then not everyone will be able to understand. So, taking the
Yeah.
example of a painkiller,
Uh-huh.
if someone is getting a headache or any pain in any part of their body, he used to take one tablet of a painkiller and he used to get relief from that pain. For some
Yes.
time, he used to get the relief from a single tablet. But gradually,
Yes.
with the passage of time, his body is not reacting to that single tablet now.
Yes.
Now he
Correct.
requires two tablets or more tablets to got relief from that pain. So
Yes.
this is what we call tolerance. Like he is
Correct.
taking that drug whenever he is having the pain. But now, if we talk about the addiction, we will consider it an addiction when the person is using that same opioid or pain reliever even when he is not in pain.
Yes.
Yes, yes. So that's the difference between tolerance and addiction. Tolerance means that you require more amount, but only when you are in pain. But addiction is
Correct.
something when you are not in pain, you still require the drug. You are craving for that drug.
Yes, yes. That's, I think Miss Mariam has well explained, and it has been separated very clearly, I think, to the audience. So many thanks, Miss Mariam. All right, Miss Mariam. So moving on for this fourth questions. So I will ask like this: what is the drug withdrawals? And what are the common symptoms of the withdrawals? So I just give some brief. I just make some starting point for this answer for you. So it is like so we are asking about the drug withdrawals, because our audience, our audience, even the people who taking drugs, sometimes they don't know that particular person has that, those symptoms are because of the drugs. Even they don't know. So we have to explain that, okay, very clearly, these are the drug withdrawals, and these are the common symptoms for the withdrawal. But remember, so we must, I think Miss Mariam will explain in this again. I just want to just give a start for this. Depending on the drug's type, either stimulants, the depressant, right? It's some hallucinations, right? Hallucinogens, or some, some hypnotics, whatever the drugs classifications, under drug classification, the withdrawals might be changed. Withdrawal might be different, depending on the drugs. All right, Miss Mariam. So moving forward, so can you explain about the drug withdrawals, and what are the main, common withdrawals we can see, around the substance use disorder individuals?
Yeah. Withdrawal basically means that when someone stops using that drug, now their body, to which their body has become used to, right? Now
Yes,
their
correct.
body needs that drug. When the person
Yeah,
is not taking that drug, now body is giving a reaction to it. Now what the
correct,
body is reacting to, it can be sometimes uncomfortable and sometimes even painful symptoms. This
correct.
the reason for this is that our body has become adapted to it to become to function in the presence of that drug, and now
Yeah,
that thing is not present in your body, so the body is reacting to it.
yes.
Yes.
And what are the
Now,
common withdrawals? Yeah,
yeah. Talking about the symptoms, there are variety of symptoms, and it also varies based on what type of drug is using. But we will talk about the basic symptoms so that everyone will understand.
yes,
If we talk, it can have physical symptoms as well as psychological symptoms.
correct.
Physical symptoms like the person will have sweating, shaking, headache, and it can also
Yes,
cause muscle pain, and
yeah,
heart rate issues
yes,
be also comes under this category, and nausea. Nausea is the most
yes,
common thing.
yes.
Now, if we talk about the psychological symptoms,
Uh-huh.
it can cause like anxiety,
Yes,
depressive symptoms. Cravings is one of the most common symptoms. Like the person will crave for that drug, and also irritability is very
yes.
much there. And in some
It-
severe cases, then the symptoms can go such severe that the person may start hallucinating or can also have some memory related issues like delirium or even some seizures, etc.
Yeah, I think most those the severe cases, like most of the times, like because of the let's say one of the, for example, having if you are taking the uh, marijuana, right? If you are taking the marijuana or the marijuana, so most of the time some hallucinations, delusions, even, right? If you take, if the individual take longer than, I mean longer time period, like 5 years, 10 years. So definitely some hallucinations, right? Some delusions. It's coming every day. You know that every day. So it's actually it's leads to the bipolar also. So symptoms, it's there every day, because that happen. That is like a rare cases, but that because in according to in my experience, recently I got one of the one client because of the cannabis. So he, at the moment, he has all the features of the bipolar. So because of the cannabis, he is using cannabis from a long period of time. So the symptoms, it's come like a diagnostic. Actually, it's like a diagnostic symptoms. So that's what. So see, I think the individual or the people, if you are listening, remember, if I think Mariam will agree with me. If you are listening this podcast, whoever the person who is using cannabis, you know, Miss Mariam, nowadays, I think, in the around the world, 4% of the global population, 4% of the global population has taken the this cannabis. Right? It's very bad story. And nowadays, and most of the, even let's say in America, right? Most of the state, they all legalize. They all legalize, right? So why they legalize? So they legalize like recreational purposes. Cannabis recreation. That's the making the high or euphoria or the relaxation. So due to relaxation, what they do, they legalize. So it's very dangerous situation, because even the society also moving, right, moving towards, okay, that's good for the legalization. So the society will accept this marijuana. Miss Mariam, it's a very dangerous thing, isn't it?
Yes, yes, I agree with that point.
All right. So, okay. So this would be the last question in our, our voices of recovery, living with addiction. Right. This is the last question. So I would like to ask from Miss Maria, how let's say now we have discussed about some symptoms, and we have discussed about the withdrawals and all. Let's say, so one of the audience, or one of the people, one of the individual, right, who has a substance use disorder, listening to our podcast. So from your point of view, can you explain them to how they can manage these withdrawals, and how they can handle this kind of a withdrawals towards to the abstinence of the drugs. Abstaining means you are stopping the drugs forever.
Yeah. The first thing that I would like to say in this matter is that never quit, just like never just quit it. Like one day you decide that I will not be taking that drug, and the other day you are not taking, because it can be difficult. Always start with slow reduction of dosage, reduce the dosage. And also another thing, and
Yes.
that take the help of some addiction specialist or call a doctor. Yeah, like dealing with withdrawal symptom under a medical supervision is the best way, because they will
Yes.
supervise you. You will be have a proper care, and in case of some severe symptoms like hallucinations or severe dehydration or seizures, you will
Yes.
have the first aid available all the time.
Yes.
Also
Yeah.
some yeah, yeah.
Yeah, Miss Mariam. Actually, Mariam, you have explained a very key point. So I like that point, because that would be the turning point of the individual who want to stop the drugs, and who it would. So I think Miss Mariam has highlighted the very first step. What the individual should do? Please reduce in the dosage. Am I right, Miss Mariam? That's
Yes,
what you highlighted, right?
yes,
Yes, so you have to reduce the dosage. Let's say you are taking, let's say three dosages or 5 dosages. So bring them down to like 2 dosages. Bring them down to at least even 5 to 4, then 4 to 3. So this is like a journey. Remember, right? This can't be stopped like a magic. There is a no tablet. There's a no magic, magic coin or magic drink to, get rid of this drug addiction. Remember, it's a long recovery process. It takes some significant time. So use that. Start from the beginning, right? Remember, you reduce the dosage day by day. then the withdrawals automatically, we say that it's a detoxification happen automatically. So detoxification means, right, the withdrawal, so the substance, the effect of the substance and the chemical, everything goes out from your body. That is automatically. Even you didn't take any withdrawals for the medication, medication for the withdrawals. Detoxification is automatic process in your body chemistry. Remember that. All right, Miss Mariam, I think if you want, do you want to add something?
Yes, I want to add another point that along with the medical care, supervision, and all that, psychological help is also very necessary.
Yes.
Like I was having a client, he was facing some
Uh-huh.
withdrawal symptoms. He was having the
Uh-huh.
phase of the delirium. So he was disturbed for almost 1 to 2 days. And after the delirium phase, he was so disturbed and so anxious that, ma'am, what had happened to me? I don't know. I'm so worried. What was it? And all that. So in that case, he needed the therapy. He needed some psychoeducation that what that phase was and what was the reason of that phase. So it's very good to if you go for a therapy because it will help you to recover from that phase easily and in a better way.
Yes, I think Miss Mariam has highlighted another key point. So even for the withdrawals, right? So by reducing the withdrawals, there are some therapies. I think even Miss Mariam, remember Miss Mariam is working in the mindful heaven. I think this episode will be uploaded to our Mindful Heaven YouTube channel. So even there are some hotline number. You can contact Miss Mariam anytime. So she's the clinical psychologist and she's a substance use counselor. She will be helping you right throughout your journey to reduce to abstain from the drug addiction. Remember, you can trust her. So because everybody trusts her and we also trust her, that's why she's sitting here right under Mindful Heaven. All right, Miss Mariam. So Mariam, so I'm very happy to had this discussion with you. So it was very nice. So even I have learned a lot of things from you. So I wish for your future, right? I wish all the best for your future, and I would like to invite for next coming episode as well. So because you are an incredible person who is talking about these voices of recovery and the episode of living with addiction, right?
Right, sir. Thank you so much for such a for providing this platform. It was amazing discussing these things with you, and I think we should arrange such things for creating awareness for the people to understand about these things.
All right, Miss Mariam. So that's wonderful. So I was thrilled about discuss this meeting, this episode. So let's wind up this one, and we'll keep a hope by next week. Also, we will start another our third episode. So until then, have a good night. Bye bye.